going to demonstrate today how we can do a 7-point transformation of the mid face as well as the lower face. Today we have a very young, beautiful model with us, and in fact she by profession she is a model. And let's first ask why she is here and what has made her to come here for the treatment.
Hello, doctor.
Hello.
As you are the best, that's why I choose you. And as I am from modeling field, my face looks very wide in the camera. So my concern is more like V-shaped and a more defined face. And my concern is jawline, chin and cheeks.
So you want more contoured cheek,
Yeah.
better defined jaw angle and jawline, and more prominent chin.
Yeah.
So as we have asked our patient and what are her aesthetic goals. So as she is in a modeling and acting profession and she has to be always in front of the camera, so her major concern is that her lower face or the jawline is not very prominent. Look at her, she's got very nice forehead, very nice nose bridge, but if we compare the lower face, her lower face is not that strong. So let's see what are the issues in the lower face. If we look at the ramus height, you can see it is less, it is not very well defined. The jaw angle is again, it's not very well defined. So there is the jaw angle which is between the vertical ramus and horizontal ramus. This angle is generally less in case of men, and in women it is more. When it is less, it gives a square jaw appearance to the face, but in her case this angle is slightly more, which is giving a more angular look to the face. But only thing is we need to improve the point where this vertical ramus and the horizontal ramus they are joining. Coming more anteriorly, if we see the chin projection is not that great. There are two ways to check for chin projection. One, if we drop a line from the nasion directly, you can see the chin is slightly behind. Another point is if we drop a line from the lower lip, you can see there is a gap between the marker and the chin. So this is the area which we need to fill and bring forward. And if we see from the front, you can see there is a small dimple in the chin, which again is a masculine feature, and when we are going to do filler treatment in this area, she's going to get more defined, a V-shape appearance for the jawline and a pointed chin appearance. So now I'm going to check her facial dimensions with the help of this caliper. So you can see this is the intercanthal distance, and now let's see the mouth span. You can see the size of the lip as far as the mouth span is concerned. It's a perfect phi ratio from the intercanthal distance. Now let's check the mouth span, and now we have a point where the jaw angle should be. You can see this is a point where we need to have prominent jaw angle, and I'm going to mark this area. Also in women, when we measure the chin or when we make the chin more prominent, it has to be in the area where intercanthal lines are. So this is the intercanthal distance, and if we go on the midline on each side, so I am going to stay in this area and inject between these 2 points, because if I go lateral to this, then the span of or the width of the chin will increase, and that will give it more masculine appearance. So in men, when we measure with the caliper, these are the points within which we inject when we inject in the male chin. So you can see the difference. This is the point where we try to improve the chin in women, and in men it becomes more wider and squarer. Now I'm going to show you the anatomy in this area. First, I'm going to draw some muscles in this region. So starting with the masseter, this is the strongest muscle. It arises from the zygomatic arch and inserts on the lateral part of the mandible. So this is our masseter muscle. Another important landmark in this area is the modulus. So modulus is present about 1 centimeter lateral and 1 centimeter below in Asian. So this is the modulus, and from here we can draw the depressor anguli oris muscle, which are the other muscles which insert into the modulus. So we have zygomaticus major coming from above, from the zygoma, and then another muscle which inserts into modulus is levator anguli oris, which comes from just below the infraorbital foramen. The muscle which pulls the modulus laterally is the rhizorius. It is lying in very superficial plane in the SMAS layer, and there are some muscle fibers coming from the neck and inserting into the lower face. These are the platysma muscle fibers, and the muscle which is present around the mouth cavity, this is orbicularis oris muscle. This also inserts into the modulus. So these are the muscles which insert into the modulus. Other muscle which is lying in a deeper plane and inserts into modulus is buccinator. Medial to DAO, we have a muscle which is lying in the deeper plane is DLI, depressor labii inferioris, and in the middle we have fibers which come in a hockey shaped manner coming from canine fossa and inserting into the skin in this area. These are mentalis muscle fibers. So these are the muscles which are present in this area, and when we are doing filler treatment in this region, it's very important to know about the vascular anatomy, and I'm going to show you the important vessels which are present here. Just anterior to the masseter, there is entry of facial artery in the face, and it takes a tortuous course, and during its course it gives multiple branches. The first branch which it gives in the neck is submental artery, which runs in the submandibular and submental plane, and then it becomes superficial and runs in the paramedian position. Then next branch which is given by the facial artery is inferior labial artery, which runs under the DAO muscle, and then after coming out from DAO muscle, it runs on top of DLI muscle. It runs in the labiomental crease. Then the facial artery, it runs under the modulus, comes out here, gives a branch to the upper lip, which is the superior labial artery, and this superior labial artery also gives branches which goes into the columella. Then it continues taking a tortuous course, giving inferior alar artery, superior alar artery or lateral nasal artery, and it continues as angular artery. Also in this area, another important artery which is present in relation to mental foramen. So from the mental foramen in this area, we have mental artery, which is continuation of inferior alveolar artery. So these are the important arteries which are present in this region, and just lateral to the facial artery but taking straighter course and a slightly bigger lumen is the facial vein, which is present lateral to facial artery. So when we are injecting in this area, we should be aware of the layers in this region as well as the vessels which are present in this area. So I'm going to inject her in the cheek, on the cheekbone, in the subzygomatic area, jaw angle, and then the chin area. When I'm injecting in the cheek, I should also be aware of presence of zygomaticofacial foramen here, and through which zygomaticofacial artery is coming. Also, when I'm injecting in the subzygomatic area, we have transverse facial artery, although it's in a much deeper plane, but it is present in this area. And when we are injecting more laterally, we have a very prominent vessel which is superficial temporal artery, which is present more laterally. So when I'm using cannula in this area, I need to be careful about this important structure also. So these are the important vessels which I need to take care of while I'm doing my filler injections. So the treatment plan for this patient is, we are first going to do CK1 injection point using a cannula. So this is going to be this is the zygomatic arch. So we are going to work using a cannula and inject in this area. The treatment plan is that we are going to inject in the CK1 area, then we will be injecting in CK4. This is the jaw angle, and you can see it is quite recessed. So I am going to enhance this part again using a cannula. Then the next injection point is going to be C1, then C2 on both the sides. I am also going to give injection in the midline in the supraperiosteal plane, and then finally I am going to inject in JW4 and JW5. So this way we are going to perform 7-point contouring of the mid face and the lower face, starting with CK1, CK4, JW1, C1, C2, JW4 and JW5. So as you can see, there are 2 points, CK1, CK4 in the cheek. Then there are 3 points in the jaw, which is JW1, JW4 and JW5, and 2 points I am going to inject in the chin, which are C1 and C2. Now I am going to show you the marking of my injection point. So we are going to first do CK1 injection in this area. So this is the boundary of the zygomatic arch. So this is my CK1 region, and below this we have CK4 area. This is the jaw angle. You can see where the vertical ramus and horizontal ramus, they join. So this area, this region where I am going to inject is JW1, in the chin, this part where I will be injecting, this is C1, this is the midline. I will be injecting C2 region in this area, and finally JW5, and this is going to be my JW4 injections. So I'll mark it on the other side also. Can you tell me a bit? So this is again on the left side we have CK1, and just below the CK1 this is CK4 and this is the JW1. So that completes our marking, and now I am going to start the injection. We disinfect the area by cleaning in the region where the entry point is. I am going to clean on the other side also. Which is CK1. I'm going to use cannula. We do a pinch and pull maneuver and we go slightly obliquely like this. Lift the skin like this. Clean the entry point. And now with the tip of my cannula, I can feel I am in the supraperiosteal plane, or also it's called the subsmash plane. And along this zygomatic arch, I am going to inject. So I am using Juvederm voluma. All the time I am checking if I am in the correct plane, which is the subsmash plane where I want to inject. Gradually take out my cannula and gently contour the area. Then my next injection point is going to be CK4 injection point, which is slightly lower than this, and my entry point is again slightly lower in the submalar area. Again I lift the skin, pinch it. And you can see this area is, here the skin is quite tightly adherent to the underlying tissue. So it's very difficult to create a plane of injection in this area. The advantage of injecting in this area is that cheek halo becomes little less in this region, and also the width of the cheek, which is only of the size of the zygomatic arch, it also becomes wider. So you can see now we have completed the cheek injections and she's got a nice contour of the cheek. From here on I move on to the JW1 injection point. JW1 injection point, again I'm going to inject with the cannula. So this is my entry point. Now I am using Juvederm Volux. This is the entry point. Again I try to go little deep, and you can see I am in the deep plane. When I lift the cannula, it's much deeper, and I can feel the tip of my cannula at the jaw angle. So this is the point where I want to put the maximum amount of product. So with the left hand fingertip, I guide the location of that cannula tip, and I start depositing my product in this area, and you can see the jaw angle is already starting becoming more pronounced. Not only the jaw angle, both the horizontal ramus as well as the vertical ramus, they've started becoming more prominent. You can see the jaw angle is now much more defined than before. I'm going to do the injection in the chin area. So first injection point is C1. So enter from the lateral area. This is the entry point. Now we are going to treat the labiomental crease, and then from the same entry point I am going to do the subcutaneous part of the chin, which is C2. So this is the entry point. This area is quite sensitive, and also the tissue layer thickness is quite less, so we should tread this area very gently, but it's important to inject in this area using cannula, because most of the time when we do dissection and we see the location of inferior labial artery, it is running in this plane. So very gently we inject Juvederm Volux in this area. This is not only going to lengthen her chin, but it's also going to support the lower lip. From the same entry point, I go down in the chin area. I go in the subcutaneous plane. I can feel the tip of the cannula in this region. I am doing the C2 injection in the subcutaneous plane. A bolus of 0.3 ml. Crossing the midline so that there is no chin cleft left after treatment in this area. So we have used 0.5 ml for C1 and 0.3 ml in C2. Remaining 0.2 ml of Volux I am going to inject in the supraperiosteal plane in the midline to give more projection to the chin. Now I am injecting 0.2 ml in the midline. Touch the bone, aspirate, slightly lift the skin, pinch it and pull it. And now the last injection point which are left are JW4 and JW5. So next injection point is JW4 and 5. Entry point remains same for both, single entry point. Just lateral to marinate crease is the entry point. So gently go along the lower border of the mandible, reach the midline and start injecting along the lower border of the mandible. You can see now this is the tip of my cannula poking at the lower border of mandible, and I inject 0.25 ml in the area of JW4 and 5. So right now I'm injecting in JW5. I withdraw my cannula. Now I'm injecting the remaining 0.25 ml in JW4. So you can see we have completed the injection on the right side. And on this side you can already see the cheek contour, jaw angle and chin projection is already started showing the improvement. I'm going to do C1 injection point. We can check the location so that it's not on the mucosal side. Staying more towards the skin than on the mucosa. You can see my cannula is quite superficial. And now I change the direction. इस पे नीडल लगा के दे दो। So we have finished the treatment in this patient, and you can see we have in all injected 6 ml of fillers, total 4 ml of Volux and 2 ml of Voluma. Voluma mainly in the cheek area, and jawline and chin we primarily did with Volux. You can see her main complaint was that since she is an actor and model, when she presents in front of the camera, her face looks flatter, so the projections were missing. So we tried to create the projection both in the cheek area. You can see now she's got a very nice cheek projection, and the cheek contour is looking much better, and in the submalar area she's now getting a nice shadow zone, which is further enhancing the cheek contour. And further coming down from this, you can see the jaw angle. It is now quite well defined after we have done the JW1, and you can see the jawline, it's well defined. Continuing into JW4, JW5. In the chin I have done C1 and C2. C1 was mainly done in the subcutaneous plane, whereas C2 was done both in subcutaneous plane as well as in the midline in the supraperiosteal plane. And now you can see, if we ask the patient to turn her head, the vertical ramus, horizontal ramus as well as angle, they are both looking quite defined without increasing the width of the face. And if we go right till the chin area, you can see in the profile the chin projection has improved. It's almost in line with the lower lip. The lip length has also, the chin length has also increased, because we have injected in the labiomental crease, which has opened up the labiomental crease, and it has pushed the chin downwards and supported the lip upwards, creating a nice shape for the chin. All in all, her jawline as well as cheek contours have improved significantly. So we've done both contouring of the cheek as well as of the chin and jawline using the 7-point approach. And now let's ask the patient how she likes her new face.
It's me.
Yes, it's you, a new you.
Yeah. The chin is more defined now. The jaw. I can see the jaw.
You can see now your chin is in line with the lower lip, so it is projecting very nicely.
Flatter before.
Yeah, so the projection has improved as well as the length of the chin. So this part has become longer, and now it's giving more proportionate look to your face. And you also got the V shape. The chin dimple which was there, which was a sign of masculinity, so that has also gone, and now it's looking more V. And also we have given you high cheekbone, which is present mostly in the top models. So you can see this high cheekbone structure is now visible.